So, dear colleagues, I'm happy to welcome you at the open dialogue for preparation of the regional uh, funding application under the C19 RM mechanism of the Global Fund. This is aimed to support COVID response in our region, Eastern Europe, Central Asia, and Southeastern Europe. My name is Inna Gavrilova. I'm a communication manager at the Alliance for Public Health, and today I'm going to moderate today's event, for which we have 2 hours according to our agenda. The main goal of why we are here is, first of all, to discuss the priorities for key populations in the region, as well as people living with HIV in the context of COVID-19 response, and public information about the existing concept of this regional application and its focuses. And this open discussion is aimed at collecting uh, full data about the relevant needs for them to be properly reflected in the application and further satisfied. So for the welcome word, I'm giving the floor to Andriy Klepikov, Executive Director of the Alliance for Public Health. Andriy, please. Yes, thank you. Dear colleagues, I'm really happy to open this event, our dialogue. It is a traditional thing for our life. The tradition is that it's online, but there is a reason to it, because we are going to discuss COVID response. Uh, Global Fund is playing a huge part in our work, because you see all the COVID programs are underfunded. And if we speak about the programs led by and participated by the civil society, it is hard to find such a strong donor, but Global Fund. It is important to note that the funding the Global Fund provides for the COVID response, this funding is not taken out from the main mission responding to HIV, tuberculosis, and malaria. The Global Fund has been able to raise significant funds. The USA provided $3.5 billion for this COVID program, and 160 million came from Germany. This decision was made a few months ago, and almost immediately they started the second wave of C19 RM program, and that is where we are submitting our application to. So we've received this proposal as the principal recipient of the multi-country regional grant, and that is why we are conducting consultations, dialogues to prepare such application at different level. We've already conducted consultations with country coordination mechanisms, and now we are going to have a consultation with representatives of the communities, of key populations, of the civil society, in order to get some fill-in to this component of the application. I'd like to point that now increasingly more attention is paid to how, in response to COVID, we take into account the needs and interests of the key populations, strengthen the programs of human rights and gender equality. So this all needs to be considered and reflected in our joint application. In addition to this, there are 2 components in the application. You know, the main funding and sort of optional funding. So during the discussion, it is important that we prioritize our suggestions. At the level of the Global Fund, I think some of you know that I'm also a member of the board of the Global Fund. So if I put this hat on, I'd like to say that at the level of the Global Fund, we were asking for COVID programs not to be purely technical, procurement oriented, medical. This healthcare systems exist beyond hospitals at the level of community too. So in order to find and support the most vulnerable, hardest to achieve groups, groups most at risk, we need to engage social workers, and that is why it's an important component really. In addition to this, we see increasingly more violations, even when we had this presentation in November, there have been violations of human rights related to the COVID restrictions, because those restrictions, they are being abused by some people, and we need to fight that actually. Uh, a more detailed presentation of the program will be presented by Sergey Filipovich. So my words are just sort of a framework explanation. I'm sharing the information that I have, something that we have in the alliance, something that we have at the level of the board of the Global Fund. And we have also a question about the timelines, because we need to take into account the fact that the implementation uh, should take place under the current project, but Sergey will tell you more about it. I wish all of us a very productive dialogue, a good discussion, and I will not be able to stay with you for the whole meeting because in 15 minutes I'm going to have another meeting, but we don't have planned or scheduled Q&A session. But if you have any questions to me, ask them in the chat and I will try to provide answers. So thank you very much. Thanks a lot, Andrei. Yeah, please write your questions in the chat so that we could try to provide good answers to those. And I'd like to introduce for the presentation Sergey Filipovich, Director of the Regional Project on COVID and HIV at the Alliance for Public Health. And Sergey will present his presentation of the overall concept of the regional application for COVID-19 response. And do you see what I'm sharing? Yeah. So good morning, dear colleagues. We are conducting this meeting, and it's not the first meeting with the partners, with the civil society, not the first discussion. Nevertheless, we would like to discuss these things once again at this particular stage when the application is being formed and shaped. We'd like to discuss once again the process itself, and we'd like to show what we already can offer. And there will be also our partners on this regional project. They will speak about their vision, about their suggestions, but the the platform is open for everyone. The floor is open for everyone to speak, to provide their suggestions or comments, or maybe somehow well, provide feedback on what is already proposed. And maybe we can take something into account and add to what's been done. Yes, now I will tell you a little bit more about what Andrei has already said. This regional SOS project, just like other implementers of the Global Fund, received an allocation letter from the Global Fund suggesting submitting an application for a budget. The main one, $1,950,000. That's my basic budget, and in addition to that, as a possible funding for the same amount. So all in all, it's 15% of the grant, which is quite a lot. Basically 30% of the total grant. And the problem that we have is that we can use this amount until the end of this year, until this regional project is still valid. So it's 6 months. The time was limited, and we chose this window for submitting this full request for funding until May this month, and there was also an opportunity to do it in June until the end of June, but we decided to do it earlier because we don't have a lot of time, and there is a lot of money, and we need to use time to actually use that to support the regional key populations and all this response process. So by the end of the month, next week, I think we need to submit this application. The requirements are usual, but in our situation, as this is a regional project, it looks a little bit more difficult because all of the requests need to be approved by country coordination mechanisms. We have 14 countries, it's 14 CCMs, and we need to get their approval. Unlike the national application, when it's difficult but not so difficult because it's only one coordinating body. And in our situation, which is shared for everyone, again, we have 14 countries, and if the context of the application is directly COVID response, there is this component in the application. We need to get an approval of the body in the particular country that is responsible for coordination and organization of COVID response. And it's not the HIV CCM. And in Ukraine, we have a CCM on HIV, and they do not coordinate COVID response. But we're not going to speak about difficulties now for some time, and the requests for funding, they are based on multi-sectoral consultations, and that's something we already do since the time of the beginning of development of the application. We've had consultations with the partners, with all the stakeholders from our region, from the ICA region and the Southeastern Europe, from the Balkan countries. We also involve civil society representatives and ensure coordination with the national COVID response bodies. Also, we can take into account existing national needs and resources. So we need to coordinate that. So funding the regional grant should not duplicate the work done under the existing programs or allocations that the countries may have under the national grants from other donors. And it's important, as Andrei has already told us, in the context of gender equality and human rights, this component should play a key part in the application, and we agreed to that, and we wanted to reflect that. We tried to reflect that in our suggestions, in our proposals. So this mechanism itself for funding of fast response, it includes 3 areas for spending the funds.
So the response to COVID-19 at the country level, and it includes the testing and treatment and provision of PPEs, and communication and other measures. The other direction is the adaptation, the measures which help mitigate COVID impact on the current programs um, for HIV, TB, or malaria, and the adaptation of programs in order to keep up with the pace. And another important project called Strengthening Healthcare Systems and Communities. In this block, what is attractive for us as a regional organization, that is the mobilization of communities and the development of community systems. That includes monitoring. So here, the measures probably may be aimed at strengthening the health systems. These topics are usually addressed in national applications, but the interests of communities can be covered by us as well. And we have prepared possible directions, and that they were included into the letters which we sent to the committees, asking for proposals on each country. And this was relevant to the three blocks which I mentioned at the previous slide. They were merely a guideline, or not even a guideline, but something to focus the attention of the countries. There's, for example, COVID rapid tests for key populations and their contacts, or oxygen stations and the corresponding equipment, the concentrators, the masks, flow splitters, and so on. That also was part of COVID. And what we call syringe mats, or vending machines. Their application in COVID times becomes more important. So machines which are vending condoms or syringes, and rapid tests also could be dispensed via vending machines. We are now planning to pilot also vending the medications through vending machines. Also internet services. When we are enduring these intermittent lockdowns, the services are going online. The chatbots, the virtual COVID consultants, interactive applications, portals. Also the support of state institutions in the transitioning to online services, like electronic healthcare, for example. Also, we have suggested an idea relevant for young groups. Representatives of key populations of young age. We need a research considering the needs of those people. Our partners on the regional project whom we contacted first, we had consultations and discussed possible activities. This is the Eurasian Harm Reduction Association, the Eurasian Coalition on Health Rights, Gender and Sexual Diversity, Eurasian Network of Key Populations, the Eurasian Network of People who Use Drugs, the Central Asian Association, People who Live with HIV, our strategic partner, 100% Life, and UNAIDS, and also the WHO. They also were interested in assessing and in helping countries in COVID response. And the 14 countries of the region, the countries which are engaged in the regional application. So if somebody forgot, I would like to remind that the first regional program on COVID-19, we launched it last year in autumn, and it ended, well, it will end in June this year. We call it the first, and it really was the first regional program for COVID-19, which used the C19RM. So what did we do in the program? We bought tests, the COVID-19 rapid tests for the countries of the region. We've launched a platform on telemedicine in Bosnia. We've bought condom and syringe vending machines for the Russian Federation. We procured PPEs. Also, we were providing assistance with the continuity of services, for example, delivery or supplies of syringes and condoms. And we also started planning for contingencies and emergencies to make sure that the services in the EECA are provided continuously. And we will be able to extend the provision of the technical assistance and to extend it at the national level. And the response to this was quite good. We had also access to comprehensive support for women who use drugs in the situation of violence. So we supported the shelters and helped train the staff with the support of our partners, the HRA. And what is planned in the C19RM component, you see it on this slide. There's equipment, oxygen stations, and perhaps also the tests would be there because we see the need for that. Also, the vaccination campaign is really relevant for the region and for different countries in the region. The interventions for young representatives of key populations, I meant it already, I have mentioned it already. The new models of coverage of key populations online and measures to promote healthy lifestyle. And this also so this was the alliance bit, and we will invite our partners also to express their view on what is needed. So the vaccination campaign has two aspects. On the one hand, there's a general aspect of promotion of vaccination, increasing awareness and creating the positive image of it. Because countries which first had progress with the vaccination, they had access to vaccines, but at some stage, let's say when they reach about 40% coverage, they start um, experiencing the reduced pace. And first, they cover groups which fit certain criteria, and then the general population sometimes is unwilling to vaccinate. But there's also another aspect in this, and that is equity in access to vaccination for key populations. That is especially for the countries who have not enough vaccine. So besides the lack of vaccine, there are also there's also ambiguity in the prioritization of PLHAVs, of group of key populations. Very often PLHAVs are not included as a priority group for COVID vaccination, and we had received a letter from UNAIDS where they supported um, the development of these interventions. Also, there would be the adaptation and launch of virtual system um, of online platform on mental health, adapted to every country in order to find the best way to offer this intervention. And besides that, we also have the adaptation and launch of the virtual system on self-testing for HIV and COVID-19 among key populations, those who lack access to testing and support. And the attention of the influence of pandemics onto young representatives of key populations, needs assessment, risks of interruptions of access to services, and the development of new interventions. Well, I think I should stop here because this was the bit which Alliance was supposed to add to the application, and I think the partners would add on the content. Thank you. Thank you, Sergey. I don't see any raised hand. So all the questions and responses were provided in the chat box. So let's proceed with the agenda. Now I would like to invite Aybar Sultan Gaziev for his comment. He is the executive director of the Partner Network Association from Kyrgyzstan. Hello. Apologies, I have my camera off. Yeah, could you please select the Russian interpretation channel? Then it would, then we would be able to hear you. Can you hear me now? Yes, yes, thank you so much. So, I would like to say that, well, we supported the initiative which the Alliance Public Health has developed in the development of regional application, and we didn't have a doubt and supported it. Well, we thought of the priorities. What should become a priority now? Because we really would want to have a wider scope of options we could apply to. But considering that the grant would last only to the end of the year, we needed to think of something which would be fast to implement. And we focused on several things. Our country, we applied the national application. We received a comment from the Global Funds team. Hopefully by Monday, we will respond unto them, and we are trying to synchronize the activities, because in the regional application, it would be better to focus on testing. I mean, getting the PCR tests, not only the rapid tests, because we do need the PCR tests according to the algorithm. For us, it's the PCR which is used for confirmation, not the rapid test. Um, on the research, which is now discussed on all levels, the research of young people um, who use drugs, we also support it. That would be a priority thing. And well, we got the appraisal from the coordination mechanism, and we've sent the proposals to the alliance. Thank you. And now I would like to give the floor to Vitaly Juma from the Eurasian Coalition on Health Rights and Gender and Sexual Diversity. Apologies. Yeah, hello, good morning, and thank you. Thank you for this opportunity, and thank you for this open discussion of our ideas, which are aimed at supporting the whole region. So in this case, in case of our organization, we work with LGBT. So our proposal is specific for gays and trans people and this population. So when the Alliance invited us to join this initiative, we've divided our ideas into two major blocks. One block is aimed at working with organizations which work with MSM and trans people, and the block aimed at directly the needs of the communities. And we understand very well that the organizations, all organizations, are now working under significant stress. That's why we would like to help, as just as Sergey said in his presentation, we would like to help our partner organizations. For example, we want to start a pilot project on including outreach workers from MSM projects to COVID vaccinations, so that we would be able to establish proper communication with public healthcare systems and to increase the awareness of the community on these matters. We know from our experience, and we have this information, that the myths on vaccination and vaccines are still quite big among the LGBT community. A major component in our work and the interviews which we organize regularly, they show that the staff of the organizations are working under stress. So it really is important to pay attention to mental health issues. That is why we would like to continue the provision of mental health services. We've organized the so-called psychological marathon, and we want to conduct a randomized study on mental health among the community and to help the staff. We want to add an intervention on prevention of burnout among the staff of the NGOs which work with the communities. This is a major component for organizations. The other major section is work aimed at the community um, and how COVID affects the community. We were thinking of a very interesting study which we called Sex and Love in COVID Times, to clarify what was the actual impact of COVID onto the sex life and sex health in LGBT community. And you know that COVID had a great impact on mental health, but also the legal status of the community has been affected, we'll continue our work to monitor human rights violations. And in this project, we would like to strengthen our work and expand it to trans people.
We would like to conduct a study on prevalence of the factors of risks of violations, violence against gays and trans people in our region, and it's research that we want to conduct. An ethical committee, everything, integrity committee, everything as it's supposed to be, but it will provide us with some scientific justification for further work, and will show general picture to us. For prompt response to violations of human rights, we would like to suggest this scheme of so-called flexible shelters. You know, there are shelters in our region that work continuously in some at some premises that we keep renting, but that is possible not in all the countries for the LGBT. We know about such shelters only in 3 countries: Ukraine, Kyrgyzstan, and Russia. But the violations of human rights happen all around the region, so we suggest this structure of flexible shelters where, as required, we provide this opportunity to get some shelter for individual cases. So, for example, we can promptly rent a flat, a safe flat, to take a person out of a dangerous situation. And again, as we've said before, it's very important, well, to do digitalization, and we are intending to speed up, well, like moving or actually changing the approaches of the e-com. We want to make all our activity digital. That's briefly about it, what I wanted to say. Thank you. Thanks a lot. Yeah, now we move on following our agenda, and I would like to give the floor to Aida Kurtovic from the organization Partnership in Healthcare from Bosnia and Herzegovina. Aida, please.
Thank you, Ina. So, hi, everyone. It is great pleasure to be with all of you. And what I wanted to share about the COVID and HIV situation in not only in Bosnia and Herzegovina, but in kind of Balkans region. I wanted to speak briefly about 3 areas. So first being the COVID response and the challenges that the health system is facing, and then how we can support the health system in response to COVID. Second is related to the HIV response during the COVID pandemic. And third is about needs of the key affected population. So let me to start with the COVID response. So we have just experienced the 3rd wave of COVID that unfortunately was quite severe, and the mortality rates were pretty high. If we speak about Balkans region, unfortunately that goes hand in hand with mostly limited, to be politically correct, but better to say poor immunization programs and poor immunization progress. That goes for all countries apart of Serbia. Serbia has done really good work on the procurement of vaccines, but unlike Serbia, the remaining countries of the region are really faced with very slow progress in immunization. So the availability of vaccines is the key problem. So discussing with ministries of health how we can support the countries in COVID response, what they were telling us is that they still need support in provision of tests And they also have limitations. I wouldn't say shortage, but they have challenges to provide sufficient supply of immunization material. So that goes for syringes, for needles, even alcohol swabs seems to be the challenge. So we are planning to, and hopefully the Global Fund will approve this initiative to support the health system in immunization efforts. Secondly, when it comes to the HIV response during the COVID, the problems are a number of, I would say. So first of all, access to healthcare institutions and healthcare providers by people living with HIV. In some cases, it is quite good. So clinicians were creative and supportive. They were providing the treatment for a couple of months, even sending it. I have heard of cases where the drugs were sent through the post office. But for some centers, that is not the case. So we have seen the letters, we have heard stories of people not being able to access the clinician to get the regular medical checkup, to receive the drugs on time, and so on. So that is the challenge that we want to address by a community-based approach, where we would offer the community-based treatment, testing on HIV, and then linkage to care. Because we are closely working with clinicians across the country for many years now, we can facilitate the access, and hopefully that can be done using the online platform. Additional challenge for people living with HIV, I have spoken many times about this, so apologies to those of you who have heard me before speaking on this, is that people living with HIV are reporting feeling of isolation, feeling of being left behind, and that nobody really cares anymore, because they are feeling, since they cannot access the health centers as they were able before the COVID pandemic, they are feeling that now all of a sudden infectious disease specialists and the staff from the health center do care more or gives higher priority to COVID response than do treatment of HIV, people living with HIV. So, and then to make things even worse, there was no timely provision of psychological support. So people have not only felt that they are not priority anymore, but they felt isolated and left behind, as I said. So we are planning to address that concern by introducing the online psychological support. We are planning to offer that across the Balkans region. The languages that we are speaking are very similar, very close to each other. So with minimal effort, we can turn this platform into the regional one. And I believe it is extremely important, because the mental health condition is not only important for every single of us, it also is affecting the adherence to treatment and desire and commitment of person living with HIV to get to the better outcome. So if people are depressed, unfortunately, they don't feel energized, even if they have drugs, so much to follow through as they should. So this is something that is really kind of burning priority. And I regret that it has taken us so much time really to be able to propose this solution and come to hopefully to the stage where we will provide the service to those in need. I believe that also we shouldn't be focusing exclusively on people living with HIV, but we should go one step beyond and make it available to the key affected populations, because so many of us, including myself, have faced the challenge to access the health system. So you turn to the private sector, you turn to your friends and your support network. But the challenge is that for many people living in our countries, those networks are really limited. And there is also a financial issue, because in private sector, these services are really expensive. So that is something I hope we can address through provision of the online counseling sessions with psychologists. And then again, feelings of self-stigmatization, again, that is something that I'm noticing from my conversations, seems to be increasing, on rise. So that is the second point. And finally, speaking about the testing and the identification of new cases, I can share with you just one piece of data which speaks for itself. So last year, this country, Bosnia, has managed to identify, some reports are saying 22 new cases of people living with HIV for the entire year. Can you believe it? Some reports are saying 24. In one half of the country, according to one report, there are 23 people newly identified with HIV. In the other half of the country, there is just one person newly identified with HIV. So that really speaks to the fact about the poor testing, poor identification of people living with HIV. And unfortunately, we have also heard about late presenters. So people are coming to the health system at very late stage when they have advanced opportunistic infections, and then they are being diagnosed because of this with the HIV. So that makes prognosis for the person that comes as late presenter much worse than if the person would be coming at early stage of infection. So, and then, yeah, I'm seeing question, thank you, Gana, to use COVID crisis to raise issues of access to low threshold outreach, medical, social services for men having sex with men, people who are injecting drugs and sex workers. So I think yes, I would say yes, particularly for the MSM because they are the driver of epidemic in Balkans region. So if we speak about Bosnia, a huge percentage in past 7 or 8 years belongs, unfortunately, to the MSM population, which is the population that is facing the strongest stigma and discrimination in this country. So we have to address these concerns, and we are taking within the SOS project. This is kind of not only COVID related. This is our ordinary work with the SOS project. We are taking this concern regularly to all ministries of health, health insurance funds. Civil society is well aware of that, and also clinicians. Where is our challenge? Our challenge is in the fact that we are not only extremely complicated country in Bosnia, but also across the Balkans region. Our political leaders, unfortunately, do not have too much support or understanding for populations that we are supporting. So we are addressing and approaching this issue from the public health side, speaking about poor testing rates, speaking about cost of people not knowing their HIV status, spreading the infection, infecting other people without intention, and furthermore, destroying their health because they are not being treated timely, properly. We have started also a big initiative on the access and the availability of the antiretroviral treatment. So you know that in Balkans region, we are trying to reduce prices of the antiretroviral drugs, that we are doing that with support of 100% Life. But we also have issues where we see that in some cities, people have access to quite good treatment opportunity, while in the other areas, that is not the case. So we have successfully negotiated with Health Insurance Fund for Federation of Bosnia and Herzegovina to expand availability of antiretroviral drugs across this region. And there will be one more clinical center, Mostar, as of September, starting to provide antiretroviral treatment. With Republic of Srpska, we are in the same process. We received commitment from both Ministry of Health and the Health Insurance Fund of Republic of Srpska to expand the treatment. The challenge is that there are only 5 or 6 drugs available and they are outdated. So the side effects that we are seeing are really not supposed to be seen at this time anymore. So we are raising that concern, and we are also working closely with the regional office of UNAIDS in Moscow, who is supporting our advocacy efforts, as well as the WHO Euro office in Copenhagen. So we got technical partners on board, we got WHO, we got National Task Force. So we are on that, but the thing is that political commitment was the first major step to overcome. Now we are at the stage of budget advocacy The commitments have been made already last year. We are hoping to see significant increase in the budgets for 2021. So we will see how is that going to go further. But it is clearly not lack of the effort. It is the challenge is that you are negotiating not only with one partner or one ministry, but actually with the entire horizon of different partners. So definitely, if I can speak of anything good in this COVID pandemic and its effects on the response to HIV and AIDS, I can only recognize that now when I speak with my government partners who were very reluctant previously to recognize that HIV is concern for us, at least now there is awareness that infectious disease, uncontrolled spread of infectious disease can pose huge risk. So we can all use that as a starting point in our advocacy efforts, because at least now I believe all governments across the region are aware that infectious diseases are not like any other disease. They can present huge threat to the country, to the entire population and so on. So that is one little tiny positive thing about the COVID pandemic. All the rest, unfortunately, is huge challenge for the HIV response. So I'll stop here. I'm happy to cover any questions and comments. And thank you, Ina. Over back to you.
Thanks a lot, Aida, for such an extended description of the situation and the priorities. And I see a raised hand here. Irina, maybe I have a question to Aida. You can ask it right now. Yes, Irina Zharuk, yes. Irina Zharuk from the Alliance of Public Health. Dear Aida, thank you very much for a very detailed and interesting presentation of the country. Okay, she's chosen the wrong channel. Other participants don't hear her. Okay, try to write it down so it will be the best way to ask the question. Okay, now let's move according to our agenda. I'd like to give the floor to Sergei Dukin from the Humanitarian Action of the Russian Federation, who is also a partner of within this application. Sergei, I'd like to ask you to share a few comments on the situation, the priorities, and the support of the needs that are going to be covered with this application. Hello, dear colleagues. I'm glad to hear and see you. Sorry, I have just joined, so I might have missed something. But from what I understand, for the second half of the year, we will have nothing because we have a country application from the Russian Federation. And the things that it was interesting and good, but what we're going to have is still a question. So maybe I'm not aware about the latest updates, but from what I know, we will not have the continuation of the process. We are now talking about the new application that will be submitted until the 31st of May. And according to that communication, maybe my colleagues will help me. Nadia Yanhol, who communicated with you on this issue, will be able to join us and comment at which stage we are now, because you're right, the thing that was before it is ending soon, but we are speaking about the new priorities of the new application. Yeah, I see. Anna Markelova, you know, she was a part of this communication. She will be able to tell. But let me tell you something about this. today we are having a meeting of all the partners, all the countries, and Russia has taken part in our previous application with a large package of service, but today we've submitted a similar proposal to you to take part in this application too, but it's up to you to decide. I know that since this year, the Russia is getting the national grant from the Global Fund, and it was told to both us and you, so that you submit it as much as possible under that grant, national application for COVID. But nevertheless, if you have any proposals that were not included or that you would like to continue doing with us, we are always open to that. And Anna was the coordinator of that project, and we informed her about it. So now it's a discussion right now, and if there is something, we are open to your proposals.
Thank you, Nadia. So, if Sergey, if you don't have any other comments on Russia, yeah, on Russia, I just wanted to inform the colleagues. The application which is prepared now on COVID, there are two countries, Bosnia and the Russian Federation. They received funding considering the fact that, well, the national grant is almost non-existent. So that's why the activities were covered, which are usually covered from national grants. And yeah, Sergey has duly said that now, as we have the new grant entering the Russian Federation, they got a proposal also about the COVID allocation. And yeah, we have discussed on defining gaps, both programmatic and temporal, because the activities of the current grant are over in June, and the COVID finding in the Russian Federation, well, we are not certain when it comes, whether it's in summer or later. So this is one of the aspects. The vending machines, well, might encounter these gaps. And there are also activities which we included in the previous application. We didn't mention them so far, and the Global Fund did not support them in general, in principle. That was on migrants. The migrants which are residing in Russian Federation, but we wanted actually to go wider, to think about both the countries of origin for migrants and the destination countries. And partly the issues with the migrants was resolved through the countries of origin. So say the migrants from Kyrgyzstan in Russian Federation, they managed to get the drugs from Kyrgyzstan. And in the previous application on COVID, it was not supported, unfortunately. And now in the call for applications, the migrants are theme, and it's quite a noticeable theme. That's why we decided to get back to this topic and to address the issue of migrants from two sides, from the countries of origin, and in our context, well, it's mostly Central Asian countries, Uzbekistan, Kyrgyzstan, and destination countries. Mostly that is Russia, and in part that also is Kazakhstan. So we have these activities. We have a partner in Russian Federation, and if the Global Fund supports this time, then it would be a good thing, because so far there's not much done on migrants in Russia. So that was just a small information to make it clear. Russia remains, I mean, our partners in Russia remain our partners. And due to the situation I've described, the needs are a bit different now. Thank you, Sergey. Let me ask Sergey Dugin if you wanted to give a final comment now, because now is a good time if you want, or shall we move on? Hello, dear colleagues, this is Anna. Sergey, unfortunately, is on the phone now. Just a second, Anna, could you speak up? Speak up? Can you hear me now? Yes, yes, now it's okay. Yeah, so I attended the Zoom call when we discussed the activities in Russia, and Sergei Filipovich has described everything as we discussed, so I don't think I have anything to add. Okay, so please stay tuned. Perhaps we will also mention some other topic where you would be able to provide your feedback. Thank you. So let us proceed with the agenda. Now I would like to give the floor to Karen Budelan from the Eurasian Coalition of Key Populations. Karen. Thank you. Can you hear me well, or shall I select uh, can you hear me now? I have changed the language. Yes, now everyone can hear you. Okay, so colleagues, good morning. First of all, thank you for the invitation to join such an important initiative for the region. We are the beneficiary of and we work with transgender people, so there's nothing new here, and we will cover sex workers and migrants among them, and well, mostly people from transgender community. So the main issue for the region, which we see now, is the lack of data. So we will conduct research, and we will be doing the research using the questionnaires which our organization jointly with the Hamburg University in Germany and the Ghent University in Belgium conducted. There was a global assessment, so the methodology was approved by the ethical committee of the Hamburg University Clinic. So it is some very solid scientific foundation. It also was approved by the International Ethical Committee, so we can easily apply this methodology, this questionnaire for our region. It's important in terms of the timeline that it would be online assessment, and the form already was translated onto different national languages of the region, and that includes Armenian, Kazakh, Tajik, Georgian, Ukrainian, Romanian for Moldova, and in Russian also it's available, and even Bulgarian, I think, the Macedonian, the Montenegrin, like we can easily cover the countries of that region as well. So the question is there. It's available online, and I would talk to my colleagues from the University of Ghent and the University of Hamburg, and perhaps the same site, the same online resources would be also used in these projects, so that this would help save time. And in parallel with that, we are going to use another mechanism which our organization has. You know that for several years we've been distributing grants, which we call Gender and HIV. And using the same mechanism, we will now issue small grants, which we are going to call COVID and HIV. Once again, we would use the same tools and same mechanisms, and perhaps we even address the recipients of the gender and HIV recipients, and then we'll propose whether it's relevant for them, their audiences, and we would probably expand the gender and HIV grants and support them in the implementation of COVID and HIV initiatives. An important aspect of the project is domestic violence and gender violence um, in general, because there's different information that when people are on lockdown for extended period of time, then the percentage of domestic violence went up. And we've received, we have data that the violence towards sex workers increased, violence from the side of the police and different organizations. For example, there are countries like Georgia. Georgia says that now they have issued fines to sex workers, not simply for offering services in the street, but also there's like a different approach. Now they issue fines to sex workers, uh, saying that they are not wearing masks and they do not adhere to social distancing. So all these nuances which exist in the region, we understand that it is uh, a major barrier, and it increases violence. People sometimes lose income, they cannot cover rent or housing, and through the project we would support different approaches to shelters. These might be classical shelters, or we would provide financial support uh, to people so that they would be able to pay for their housing, or I don't know, the utilities or the internet. I don't know, maybe because it's important now to have access to internet, not only to receive the information, but also to be able to provide the services online, for example. During the global assessment, many sex workers have said that if they had access to the internet, perhaps a phone, the microphone, camera, and the computer, and if they had 24/7 internet access, then they could be earning money by virtual sex sessions. But as they don't have money to pay for the equipment, for the internet, they have the same old economic barriers. So perhaps as part of the project, we would propose our assistance to the community by providing video equipment and the internet. And in parallel, we would conduct small trainings and counseling on how to offer services safely and securely online. How should this be done so that they would not be subjected to gender-based violence in these online platforms? So we will also have an information session. And the fourth and very important approach, which we would continue, once again, perhaps everybody knows that the Eurasian Gender Academy is quite active, but all the methodologies and the approach, all the structures there are once again about gender and HIV, and about the gender approach in HIV service projects. And we will use only the template of the Gender Academy, but we will add new content, the new concept, new approach. the name would be the same. It would be the Eurasian Gender Academy, but the content would be revised. It would be aimed at COVID and HIV, and that would include the gender budgeting of COVID projects, a gender sensitive approach to COVID projects, and if we would not be able to have it face to face, then we would have online sessions. We would have two sessions in English and in Russian. And this would enable people from different regions, from different subregions of our region who speak either Russian or English, they all would be able to take part. And this probably was the brief outlook on the situation. I'm happy to respond to your questions. Thank you. Thank you, Karen. And I don't see any raised hand, but I see some questions in the chat box. Feel free to take a look in the chat box and take part in the discussion. Next, I would like to give the floor to Anna Dovbach from the Eurasian Association of Harm Reduction. Anna. Hello, can you hear me? Yes, we can hear you well. So, let me explain what we have included in this project and what we cannot include, but we have to think about it for the next period because the issue is really large. We would not be able to cover it in half a year. From last March, the March of 2020, when the lockdown started, people who use drugs have informed about several issues. First of all, the dispensation of OST for longer periods, the need to receive PEPs, and also the loss of income and the inability to earn, and also the surveillance by the police. Now, in most countries, police has online surveillance mechanisms. They can monitor all of us, and if you moved from a city to a city, then most probably you felt that. And for people who use drugs, well, police surveillance, of course, is an important thing. So matters of security, digital security, when there's online counseling, these are huge issues. And now another thing is vaccination, access to it, and having the records. But one of the cross-cutting issues was that people, when they stay locked essentially in the lockdown, they commit domestic violence, and women lost access to shelters because in most places, in most shelters also, they do not admit people with addiction. And also sometimes they have the condition that they do not admit people with infectious diseases. So if a woman uses drugs and has HIV, even if she is on an OST, she cannot be accommodated in several municipal shelters. And in the COVID situation, some shelters were closed at all, or they restricted the requirements to new clients. But the level of violence, the level of issues in the families, it increased. And we need to remember that it's not going down. And well, Ukraine has not experienced that very strict lockdown with curfews. It was mostly prevalent in Western Europe. But anyway, this situation is ongoing. So when lockdowns continue, the issues with domestic violence, they would be remaining. And we tried to find a systemic approach to this from last December. Jointly with UNDP experts, we've developed a very good guideline. I would like to invite you. On June 15th, we will present this guidebook saying, help, not ignore. And this is about helping women who use drugs in the situation of domestic violence. And we supported 5 organizations so that they would establish support systems. And it's not only direct assistance like case management for women in situations of violence, but most important for us is the advocacy and establishing these links so that, for example, shelters would improve access, or other referral mechanisms would be provided for women who would need comprehensive services, legal services, safe accommodation, and psychological support. And as in this year, in this half year of the project, we see some really good development in several countries. Then considering the limited timeline of the project, which we discussed, the 6 months, we decided to continue work in Macedonia, Serbia, Kazakhstan, and Russian Federation and Ukraine on the systemic transformation of the services and having some long-term solution to this issue.
And that is where we are aiming our efforts in the 5 countries. And it's important we see that there are several barriers for women suffering from the gender-based violence to access support from the responsible services. But the policemen, police officers, they either don't know how to respond, or they don't have guidelines, or they have stigmatizing ideas about people who use drugs, and they initiate a totally different protocol. And it seems that calling police makes things even worse. So together with the UNODC, we want to have a regional workshop where police officers will train police officers to discuss how it's done to raise this issue. The second important point, is about social services. We see that social services often work against the women who use drugs, working against the interest of the child to deprive of their parental right, because the person is getting OST, or they take a child away to an orphanage and then take money from you for keeping the child in that orphanage, in the children's home. Yeah. That's a special cynicism of the state. So instead of support from social services, the woman gets more institutional stigma, discrimination, and violation of her rights. And so that is why it is important for us to establish good communication and cooperation with relevant services and shelters related to gender-based violence problem in the countries, and to initiate this dialogue about how this service can be understandable and acceptable to women who use drugs. There will be a few regional events related to this topic. Now, talking about things that go unaddressed, there are many more topics of that sort, and I hope that we will not end our efforts in the December of this year, talking about long-term consequences of the COVID for healthcare systems, and then we will be able to discuss the comprehensive set of services that will include employment or nutritional support, because that was a part of what was included in the harm reduction programs, and the opportunity to provide online services and mental health services. And in our case, it's not just for activists, but also for people who use drugs. It became really important, but Vitaly will tell about that. So we are not ending our discussion at that. Now about shelters. Thank you very much, Anya. And we have Moldova talking to us. Ruslan Paverga, Positive Initiative. Ruslan, please share the needs that your country has. Yes, good afternoon, dear colleagues. First of all, I'd like to thank you for all the opportunities in this recent period at different platforms. We meet each other and hear each other, because in fact it really enriches us. You don't need to invent something new, you just can take something from somewhere and implement it. That's really good. And from what I know, in all the region, it goes like that. But in Moldova, at least, the process for preparation of this application is quite open, with a very broad involvement of civil society and communities, and that's extremely good. And if we speak about the needs, they are actually open. It's just reflecting the challenges that we have, and that's quite simple and understandable to all of us. We have problems with scaling up access to services. It is difficult to reach new clients in the situation of COVID pandemic. Problems with accessing to the clients who are already in the service, because the service has changed somewhat. It doesn't work in full. Some stuff is ill, some stuff is isolated. That's another challenge. And the third challenge is the health of our clients in the situation of COVID, who has got what, in which form, how they coped with that. And I don't know about you, how you had COVID, because I've had it and I still feel the consequences. So we understand all sorts of additional vulnerability is a big burden for our clients. So of course, the the needs that we have are the following. We need to implement new technologies to ensure access to handouts, materials, because that will enable us to expand the outreach and help the clients to use those services regardless of whether outreach is available, whether the syringe and needle exchange site is open or not. And when we speak about that, they start responding to that like, but what should outreach efforts do after that? That they can get free from that low threshold service and do the things, do the services that they lack efforts and time for. More a better motivational support, consulting, so improving dealing with simple tasks, by delegating the responsibilities to machines, so to say. Second is improving communications and interaction between social workers, patients, doctors, and we can do it via mobile apps, all sorts of other technologies, without losing contact to the client, allowing the clients to work not just with one employee, but also add other specialists to the communication, let them use video chat, for example, to because now narcology is in a very difficult situation of COVID. They were able to provide substitution therapy to all people who need that. We see a big plus in that, but there is a side effect, because not all people were able to cope with having extra resources, and they increase their doses. So there is now an issue whether we need to give to take away doses or not. But our answer is yes, do it, but do it with video support, video control. Use these opportunities. And of course, we need to make the service more sensible to the COVID problem, to monitor the situation about the condition of the patients, about who got vaccinated, what's their attitude to vaccination, and respond to that. So, talking about it briefly, the main needs currently in Moldova, those that were described and everyone agreed with that, is broad and active implementation of new technology to let the staff do more complex things and create a situation where not for all the services the clients are dependent on the staff, but they could use those services smoothly without interruptions. So that's what we discussed at the national level. and those needs were included mostly in the national application, and something we sent to the alliance to include it in the regional application. Okay, thank you very much, Ruslan. That was really important to hear that from you. And now we're continuing our discussion. I'd like to give the floor to Olga Belaeva, Program Coordination of the Eurasian Network of People Who Use Drugs. Olga. Yes, good afternoon. Thank you very much. I represent the European Network of People Who Use Drugs. We also take part in preparing this application, and the amount of our activities is $100,000. It covers three tasks. First is to protect the protectors by using the health insurance policies or providing direct support to people from key population. The second is a prompt response to provide nutritional support, rent and apartments, like Vitaly said and other people said, that we need to respond really faster to the situations of emergency where shelters are closed and we cannot get access to all sorts of services for people from our community who are now in a difficult situation, all the countries of the ENPUD. And the third task is preventing the supply interruptions of OST drugs, like it was in some countries at the beginning of this year because of lack of coordination of supply and the COVID, which really affects these things. But also there are moments about bidding documentations. You know, it happens like in our country, we have an expert council for treatment of the input, and the task is to prevent interruptions, continuing provide and take away drugs, working in homes settings, ensuring access for people who live in Russia and have HIV and tuberculosis, but cannot treat tuberculosis because they have drug dependence, and we need to somehow come up with the idea of how they get pain management. So we have a task force working on that. So these are three key tasks that we have worked on and will be working this year. Thank you very much, Oля. And now we are going to have also Daniil Kashnitsky, who will tell us about migrants in detail, about their needs. And yes, well, he is joining us, and I'm here already. Oh, okay, great. I haven't noticed you. Sorry. Daniil Kashnitsky from the Regional Group for Migrants Health. Daniil, the floor is yours. Tell us, please, about the needs of this group currently, the group that you work with, and what support would you like to see included in the new application for COVID response to the Global Fund, which will be submitted by the end of May. Thank you very much. Inna, very briefly, because the Global Fund has limitations we learned about recently, we are now reformatting our tasks. And the main accent include considering our yesterday talk about the online services. When the Alliance report was presented, we need to provide a second impulse to the online services for migrants in the receiving countries and host countries. And that's what we suggest, the project on migrants at the basis of regional expert group and Central Asian network in Kazakhstan. It's the second country, host country in our region, and make an emphasis on development of online clinics. It's consulting a broader range of specialists for migrants who seek remote consulting. It's not just infectionists, but also dermatologists, psychologists, depending on the needs of people. That's the main component. And also we included there analysis of a more in-depth analysis that will take into account the structure of key populations among migrants, the problems they encounter, and what solutions are the most effective. So the online clinic study, and we also suggested two activities above a location. And one of them is uh, educating the diasporas, including the migrant organizations. And the second point, first is migrant, second is uh, educating journalists. That's what, if I were to tell about it very briefly, that's what corresponds to what we identified as our needs. Thank you very much, Daniil. Also, it was important to hear that and discuss it right now all together. Dear colleagues, if you have any comments about right now about this migration component, you can ask the question now. Okay, then I would like to ask a question, if I may. In principle, today it's been mentioned a lot of times that the needs of the countries, but I would like to ask all of you, the whole audience, those who would like to say something about it, to do it. Is there a need in the region in procuring rapid tests for COVID? In the first application now implemented by the Alliance for Public Health, we practiced this intervention, and several countries, we supported them with rapid tests. So the question is, do you have this need now? And is there a place where such testing for key populations, of course, should be conducted? I see Sergei's hand raised. Sergei, please. Yeah, thank you very much, Ina, for raising this issue. Because in fact, I think that there is no, well, the access to such rapid testing in our region is very far from actual needs. And when we hear that they have tests, they don't have problems, there are problems actually. Name a country where you can, without you just come and get an antigen test free of charge within 15 minutes. No, it doesn't happen. Even the position of the WHO that we used for the present application, that you need to test people with symptoms and those of contact. Yeah, but that's again limitation. I'm not against that, but there is a group that we cannot call symptomatic or contact. But for example, they go to a syringe exchange site, and he's already infected when he comes to that, but he's not a contact person. He doesn't yet have symptoms. So this opportunity in the actively tested countries is provided, not just for key populations. Every person twice a week can get tested free of charge. And if he wants to go to supermarket, a museum, a zoo, he takes a test and gets the support confirmation. That's one of the aspects. You can write to us if you wish about that, because I think that this is a barrier to spreading COVID, because we have not stopped the pandemic yet, because vaccination is great, but active testing and chain breaking approaches, they don't exist in most countries yet. That's one thing. Second, and that is something we are trying to discuss now with the Global Fund, is rapid tests for HIV, and to be more specific, for self-testing, oral tests. The Global Fund and the COVID is quite reluctant to provide support with expendables for HIV prevention, such as condoms, syringes, other materials, thinking obviously that it should be covered by the national grants. And that's probably so. But again, in the situation of limited contacts or limited access to services, the most acceptable, and we heard about that yesterday, yeah, when the results of the study were presented, showing that in our region we did notice the reduction of testing and access to antiretroviral treatment, and one of such intervention was sending oral tests which people could use to learn about the status. In the normal situation, this intervention is not quite common, and we consider it one of the mitigation aspects, mitigation of the consequences of the limited access. So, what do you think about that? What could you add about this? Yeah, that's what I wanted to ask actually. If we don't do it now, we can write about it later. So, yeah, I see questions from Ruslan and Ola. Yeah, talking about rapid tests for COVID, we need them. The thing is, we need to properly calculate the needs so that they are used to the utmost effect. We are now implementing rapid tests, and we already see positive cases among clients who are then referred to treatment. It's important also that we can uh, test our employees because they contact the clients, and we have this responsibility. And especially important when you work in prisons. We're now the only organization that works in prisons, and one of the reasons is that we have an opportunity to test ourselves and our staff as many times as we need. And talking about the criteria, it's not just about symptoms. It's when some people from the close circle or they know that they got COVID. So it's something that is needed. Yeah. Now talking about handout materials, it's pretty logical because they are sufficient in the country grants, but the question of accessing those handout materials, the question of testing is still relevant. So condomats or other vending machines, it's not really a vending machine, it's a service provider working close to the clients 24 hours a day. Now, talking about improving access to testing through delivery, that's also a great idea. And it's unique not just in the situation of COVID, because we started this process through various Telegram channels, and we are reaching the clients who are not a part of the service. And thus, we are improving access. We are improving coverage when we can provide delivery to where the client is located. So in Moldova, we totally are in support of these initiatives. Thank you very much, Ruslan. Now, Ola, the floor is yours, and Anna, after you. Yeah, we also thought about that. Yeah, now do you hear me? I'm sorry. One moment. Now, do you hear me? Yeah. Well, it is always better to have a vaccine. We thought about vaccination, and the point here is that we need to understand the, how the vaccine works with psychoactive substances in the body of a patient. Those who work with vaccines, could you please check that? Can we provide vaccination because it would be more convenient than testing. So when do you need test, and when we see symptoms, when we do screening, we understand that, or as required by a health institution to get on the OST program or other programs, you need to get tested for COVID. And the situation may be quite different because well, you need get to get tested and to be included in the registry. because for a rapid test to be done, you don't have then to go to and make a ELISA testing or PCR testing to get clinical confirmation. So the tests that are needed, and yeah, we need to see how we can do it. Thank you very much, Ola. Anya? Well, I think I'm not sure that we need countries for all. I don't think that all countries need the test. The biggest question is who provides it and who distributes it. Because where the Global Fund pays for harm reduction services, so there is a chance, even though it's an additional work. And the Global Fund often does not include additional payment to social workers for these extra hours. And if the Global Fund pays not for the whole work of outreach or none of it, then there is a question of, okay, tests are great, but yeah, and this motivation for vaccination is great, but who is going to do it and who will do this outreach work? And we encounter, sorry for this philosophical issue, it's not for this half a year, but we actually see that harm reduction outreach training is absent, but we expect that they will deal with hepatitis and tuberculosis and COVID. It all should be done by the same social worker who already has a workload of 10 minutes per client per month. So I suggest that we keep it in the focus of our attention. And if I may, one question not about the test, about digitalization of services. There is a discussion, and I would like to add it in the chat to document that. We, together with Ecom, or rather Ecom was leading this activity, we conducted large assessment. Soon it will be published, the report about switching to digital services. Almost all organizations have got experience in providing online services, and not all of them are ready to switch to regional chatbots or consultation systems, even though this idea is in the air.
So, considering the specifics of the counseling, and from our side, our logic was the following. We thought that we should do an online course for the outreach consultants, and now we already have the resource for that thing. And I heard about chatbots. So, colleagues, at the regional level, jointly with the national level service providers, let's talk about this. It is not a matter of the presentation of our products. It's about the brainstorm. It's about the discussion on the content, so that we would not develop two products in parallel. We have to understand how all of this fits, how all of this helps every organization. Thank you so much. I'm ready to initiate this meeting among all of us who are engaged in this process. So feel free to write me just onto email or my Facebook Messenger, because we want to all to really stay together, stay in touch on this. Thank you, Anna. I would like to voice another question. As part of this application, we see a need. Well, countries have different information about vaccination and confidence in vaccines. So we see that there is a need to have this regional awareness campaign, in particular for the key populations. And it would be able to provide good explanation and to respond to all the questions raised by Olga. And they would hopefully help get rid of some barriers and fears, because yeah, people face a lot of information, and sometimes they get overloaded and they find it difficult to track and verify what is true and what is just another internet fake thing. So do you have any opinion whether this is required or not? If you have any specific proposals, we already have the support of the regional office of UNAIDS. They are happy to join us and to develop this campaign jointly. And now I'm happy to give the floor to Aida. I see she raised a hand. Over to you.
Yeah, so thank you once again. So one thing that I forgot to mention, apologies for that, when I was speaking about the current situation and need to raise the awareness. I mentioned that Serbia has done a great job with procurement of vaccines, not only for its own citizens, but also for citizens of neighboring countries. For a while, it was available, and even people from the EU countries were coming to receive free of charge for them vaccine, and second re-immunization also was offered and planned. So speaking about that, with all vaccines available in that country, they are not able to pass the threshold of 42% of the population being immunized. Why? Because across the region, we have very strong anti-vaccination movements. So if you're speaking about regional awareness raising, I also want to nominate the immunization campaign for your consideration, because it is not only in Serbia, it is the common challenge across the region. For years now, we have very poor immunization rates for children. Unfortunately, that also affects COVID immunization now under pandemic circumstances. So this is a public health concern, because if this goes on forever and without good immunization program, we will continue to suffer in HIV response and in all other responses. So I believe it is our best interest if we can do something about to start the regional immunization or pro-vaccination campaign. I'm very flexible about how to call it, how to approach it. We can do it either regionally, nationally, there are language barriers and so on. So it is kind of bigger topic, but there is real issue one day when all of our countries, hopefully soon, get vaccines in quantities we need, the next barrier to face will be, unfortunately, an anti-vaxxer campaign. And that does affect people. So you cannot believe what are we hearing here. So it is all the stuff like from shipping to reducing fertility to controlling the population. And people do buy in. So we have to do something about that, because this is seriously affecting the population's health and unfortunately also our ability to support people living with HIV.
Thank you. Thank you, Aida. Indeed, indeed, it is very important to have the information available widely, to have this constructive and verified information available, especially for key populations with concomitant diseases, and then they would probably be afraid to vaccinate. So, dear colleagues, so yeah, I see that Vitaly Juma had a hand raised. Yes, thank you. In terms of regional campaign, yeah, of course, indeed, there is a need to increase awareness. We also plan working directly with the LGBT community on this direction, and indeed, a regional campaign probably is required. On the other hand, however, if we talk about key populations, they are different, so the messages have to be tailored for them. If we have one campaign for all groups, it means the campaign for the general population. So then we need to see how we can be really specific. So yes, regional campaigns are good, but it has to consist of several components targeted at specific key populations. So a message for gays should be different than a message for people who use drugs and so on. So here we also need to be engaged. I mean, the networks have to be engaged. But yeah, I concur as I said previously, and just as Aida mentioned, there are so many myths in the region, and there are sub-myths in our communities, which are also reinforced. So yes, we have to work on this. Thank you, Vitaly. Yes, I concur. It really is important to have a very specific message tailored to the needs of communities. And I would like to add that definitely this information campaign would be first and foremost aimed at key populations. But there is a very important thing we cannot ignore. The representatives of key populations, they live in the society, they have their environment. So now the problem is sometimes not really specific to a group, that people have a fear only because they belong to this population. The fear is there in the public. I mean, it's wide, and it's the society which influences the key populations. So the campaign will anyway have a bit general approach. But of course, when we develop the program, it's important to consider all the efforts of the regional partners, and we could really consolidate these efforts into a work group which would develop this campaign. And at the same time, we have to really work fast. We have to launch it, well, by the beginning of autumn, because there's not enough time left, but we will be able to discuss it in more details when we have the confirmation from the Global Fund, when they say, yeah, sure, we support this. By the way, we have Snezhana Kolomets from the regional office of UNAIDS. Snezhana, I would appreciate if you could comment on this. Hello, dear colleagues. Thank you, Inna. If you could select the Russian channel, that would be good. Can you hear me now? Snezhana, please select Russian language channel. I have selected. Can you hear me now? Yes, everyone can hear you now. So, dear colleagues, I would like to know just two things to clarify the stance of the regional office of UNAIDS towards this initiative. Of course, everybody understands and supports the need for these initiatives, but there are also several important aspects, and colleagues have already mentioned that there really is a strong skeptical approach of the society and these anti-vaccination movements. So the problem requires a comprehensive solution because it is really wide and deep. But if we set some specific targeted tasks, we would be able to achieve things with this campaign. But yeah, if you want to approach this field, first we need to understand who is doing what in this field, and many things are done in this field. And firstly, I think we should engage national partners, because I think in almost all the countries, they already have some information campaigns on vaccination. And of course, we have to engage the UN structures, at least the WHO and UNFPA, those which also work in this field. And another important element in this campaign, I think, would be the effectiveness indicator, because we know that unfortunately awareness campaigns, they suffer from this. They have things well packaged, but sometimes the effectiveness is not really well measured. Thank you. Yes, I concur. Thank you. Thank you for this important addition. Dear colleagues, so it's 2 minutes to the hour, so we have 2 minutes left. According to the agenda, and perhaps you want to give a comment. I see that Olga Belaeva has a hand raised, but perhaps the hand is just raised since the previous comment. But Olga, if you want to add now, there is an opportunity. Thank you so much, and nothing from my side. Okay, I don't see any raised hands, so I would like to give the floor to Sergey Filipovich. He opened this event, he presented the general concept, so I think he could conclude. He could provide a summary to this event. Thank you. Thank you. Yes, I would like to say thanks to all of you for expressing your interest in this discussion. We really could hear that people discuss matters which are really close to their heart. Also, I can say that the initiatives which were proposed by the Alliance jointly with the partners, they really were supported in the discussion. So overall, it was well received, and there were also proposals on how to improve and develop things on the on digitalization efforts and the awareness campaign. Yeah, we have to balance between the general and the targeted approach, and yeah, this probably would be the implementation approach after we get the endorsement of the Global Fund on this. Then we, of course, will consider this, and we will have open discussions on how to do it, both on awareness campaigns and on digitalization. We would have another meeting with all the stakeholders so that we would understand what is the experience, the needs, and the risks. So we'll continue working on the grant and according to the principles we have always followed. The principles of openness, engagement, and transparency. We will look for platforms to discuss all this. Thank you. Thank you for this discussion, for your proposals. Well, this is it from my side. Thank you. Dear colleagues,
Sergey.
if
Thank you so
anyone
much.
wants to say some final remarks.
No final remarks, just words of gratitude to everyone and to Sergey. So thank you, guys. It's been great.
Thank you, and goodbye.
Bye.